So Leah,
Yes.
I'm so excited. I have had multiple clients send me articles about you or links to your app, Postpartum, regarding the work that you do to help women pre and primarily postpartum. I know specifically around oh my gosh, help me out. Say it for me.
Okay, everybody struggles to pronounce this one. So the woman who taught me about diastasis recti says it that way, diastasis recti. She's from Chicago. But I've also heard doctors say diastasis recti or diastasis recti. We can say DR.
DR. There we go.
DR, that works. Yeah.
Well, talk to me a little bit specifically about what it is that we're talking about and how many people it impacts, and then a little bit about like your journey and your work helping people deal with it.
Sure. So I think a picture is worth 1,000 words. So I have one. I will share that.
Good.
Like part of my definition. And this is literally like a laminated medical illustration that I carry with me everywhere, like, because people are always confused. So anyway, I know there's a little glare because there's windows.
No, I can see it great. Yeah, it's perfect.
But so here we see a very classic separation of the rectus abdominis muscles. And this happens about 60% of the time. And that's even with just a singleton pregnancy. It's higher with twins and multiples, and a first-time pregnancy. We also see much higher incidence after a second or third pregnancy. So this I'd say is pretty standard separation that I would expect from a woman who's had 2 children and did not do any exercise to rehab between pregnancies. Okay, this is probably 4 centimeters in width and a moderate to deep separation. And we can talk more about that in a minute. This is where I bring my clients to full resolution, and we bring the muscles all the way back together. And as you might notice, the waistline also changes. So even like apart from fat loss, whether or not that's a goal, just bringing your muscles together also changes your waistline and kind of brings you a more hourglass figure. So I've actually had quite a few clients who postnatally had to have their work pants tailored and brought in because they actually had a wider waistline before their pregnancy than after they've done the full rehab program. So
basically the rectus, the abdominal muscles separate.
Yes.
Because of being strained during pregnancy.
Yes.
Could happen even if you do all the right things. Certainly could happen if you don't prepare appropriately. I think I heard that right.
Yeah. So just to back up for a second, the most common cause of diastasis recti is pregnancy, but it can happen apart from pregnancy. I've actually helped professional athletes and men fully resolve diastasis recti, and they've never been pregnant. So, but it is due to mechanical stress on the linea alba. That's the connective tissue that runs up and down the center of your rectus abdominis. And in case anybody's kind of afraid, like, oh my God, my abs are torn apart. It's not a tear. It's not literally a tear of the tissue. That can happen when the tissue overstretches, which is diastasis recti is an overstretching kind of laterally of that connective tissue. When it's overstretched, it's weak and a little vulnerable. So there could become a tear, and that would be a hernia. So any tear right at the umbilicus is an umbilical hernia. Those are very common. They can lead to an outie belly button after a pregnancy. And any tear kind of along the rest of that midline would be called a ventral hernia. And that can be pretty serious and require surgical repair, a hernia, an actual tear in the tissue. But an overstretching of the tissue is something that your body can't like, a lot of things stretch to make room for the baby, and everything doesn't stay in that fully stretched out state. Things start to contract back to their sort of original tensile, contractile integrity. And so my program and 2 of the studies that I published, one with Will Cornell, one with Hospital for Special Surgery, demonstrate how very specific deep core exercises help bring those muscles back together, and they restore strength and integrity not only to the muscles, but also to the connective tissue. So that's,
I think there's two things jump out from, and it's I'm a man with no kids. I have seen a man. The biggest example I've seen was on a man many, many years ago. I was like, I didn't realize that So that thank you for bringing that up. But I heard structural integrity, and I'm like, oh, we got to fix that, right? Like, many people, thankfully, most of my clients, like that's what they're looking for. They want to be strong. They want to have maybe another child, or they want to be able to pick up the child that they just had. They want that structure. So I love that term, like structural integrity. I love that you said like this is common. I think you said 60% of pregnancies at least can result in that.
That's actually the most conservative statistic, is over 60%. I've seen some studies suggest as high as 90% at the end of pregnancy. There will be some separation that is 2.5 centimeters or greater, which is the diagnostic criteria.
Well, and I love the clarification that you made, that it's not a tear, that it is an overstretch. It's a contraction, right? It's been pulled apart. It is weakened, but that it is treatable. And we can talk, I would love to talk in a little bit about the technique and how that happens, and how you like help people do that, so that, like, it's super duper scary. Like, I know so many women are like, they're like terrified. I have had prenatal clients say that all I want is for that not to happen.
Yeah.
But I do, so there's that, the structural integrity part. But then the other part, and I will say I tend to be, because I've never experienced pregnancy. Yeah. And this is not as widely known to this degree. I have had clients say like, oh, I've got like the stuff, Instagram says the meanest stuff to women. I've had clients say, JJ, am I going to get, I might say it wrong because I don't, this isn't my algorithm, but like, do I have saggy mom butt? I'm like, that's a thing. And I've had a client say like, that is literally like hashtag, like, don't get saggy mom butt. I'm like, oh no. And then mom belly is the other one. And one of the reasons that we're having a conversation now is I had a client who said like, I have mom belly, and I have a hard time. Like, my clients are clothed, obviously, and they're all beautiful and strong to me. And I'm like, just be reasonable. And I did have a client say like, I'm not back. And I'm like, just give it time. And she did the test that we'll show in a bit. I think she saw an article about you in NPR, actually, about the work you do with women. And she said, I think I have this thing. And I'm like, I thought you would know. Like, you left a really good doctor's office with a baby. Surely if you had this thing, you would know. Yeah. And it turns out she has it.
Yes.
And so that's like, that. It's just mind blowing to me. But the reason she sought it out was she did not feel like her body was looking like, you mentioned like circumference of the waist. Like, she felt off in that regard, and that was a sign for her. Yeah. And so maybe we could just
So that's one of the most common indicators that diastasis recti is present, is if you kind of have a protruding belly, or if you're like, maybe you see a friend you haven't seen in a while and they congratulate you on your new pregnancy, and you're like, I'm 5 months postpartum. I'm not pregnant. And then you want to go cry in a bathroom because you look pregnant. It's so common, and it's a frustration. But that's more the sort of vanity side. And let's be honest, a lot of us care how we look, and we're judged by how we look, whether or not we want to pretend otherwise. But on the deeper sort of functional side, when we think about the body and the core musculature, like in the back of the body, we have a spine and all these muscles insert into the spine. At the front of the body, we have our organs, and the only structural support in the front of the body is muscle and connective tissue. And so when that connective tissue gets weak and thin, and it literally goes from being like a very springy, elastic rubber band to being kind of like cellophane, like plastic wrap, your organs fall forward. So you might think like, oh, in the morning I wake up and I feel kind of like myself. Maybe my abs feel flat. I don't feel bloated. But by the end of the day, it's like everything's falling forward because there's nothing to hold in the organs, literally.
Yes. And I mean, you said linea alba, and I was just to revisit the drawing. That's the part that, for all of us with six packs, it's that deep line right there. Yeah. Like, no wonder you would be poochy and feel like your pants, like you were, I don't love this term, but people will know, like muffin toppy, right? Like if you're wearing your pants and the core, your cylinder isn't tight.
Yes.
Because of structural stretching, you're going to fall forward. That makes sense to me.
Yeah. So that impacts posture. It impacts stability. And And often, and our body is so wise, it will compensate. So if there's a lack of stability or structure where it needs it, then all of your other muscles recruit to like say, oh, let me help. And then we have overactive pelvic floor, which means like chronic tension in the pelvic floor, which can lead to pain or hip pain or back pain, especially low back. It's so ready to take the brunt of your load of whatever, whether you're lifting your child or lifting your child in a car seat, which is really hard. Suddenly the low back is doing everything because your abdominal muscles can't fire how they should do the separation. So there are a lot of very real health and functional implications in how we move, how we lift, where other muscles that take sort of work they shouldn't be taking. And then there's also sort of pelvic floor symptoms that go along with this. So often when there's diastasis recti present, we see a higher incidence of urinary incontinence, especially stress urinary incontinence. And the good news is that when we bring healthy motivation to those deep core muscles, they work synergistically together and everything starts to work better. So we have better continence, we have better sex, we have better posture, we have better just like overall strength and core stability when we're doing everything we do in our lives. So, it's just like your body is so powerfully resilient. I mean, you just birthed a child, if that's, why you have DR, and it can recover from this. It just needs a few tools and a few like very specific like exercises that will build the muscles that we need to build without any collateral damage.
Can we talk a little bit about what you would suggest an expecting mom do?
Yeah.
Like either specifically or in general, like how, like what, and I know that you have some tools. I know that you have an app that people can go to. I know that you do like workshops. So like, feel free to talk about any of those things as well. But like in general, like for me, and I'll speak, I know you're also, we have the same training back, like CPT. So in general, like, I've trained a lot of women throughout, like before, during, and then postpartum. And in general, we follow the rule of like what you're conditioned to do in terms of like strength training and, like complex compound movements and pulling and all of those things. We continue to do that. Mm-hmm. We don't like add new things. We don't like start sprinting or like start Barry's boot camp, once we know we're pregnant, but we generally continue to do those things. But are there specific types of things that to enforce that integrity of the linea alba and the rectus abdominis, like feel free to speak like before giving birth and after, like once it's happened. Does that make sense?
Yeah, absolutely.
Okay, cool.
So let's talk about during pregnancy first. Okay. During pregnancy, you can actually largely avoid or minimize the separation with very specific preventative exercises. And you can't prevent everything. If you're pregnant with triplets and you're short-waisted and a short person, things have to stretch. There's going to be some more mechanical strain on that tissue than if you're tall and it's the first time, like one baby pregnancy, so mm-hmm. So I'm not trying to say nothing is your fault, but if you are currently pregnant and you're like, oh, I would love to do what I can to minimize or avoid this separation, the good news is you can do that. And there is a study that was not my study that was published, I think 1995 with Columbia with their physical therapy department. And they looked mm-hmm. at women during pregnancy, and there was an exercising group that was focusing on deep core activation. And when I say deep mm-hmm. core, I mean specifically the transverse abdominis.
Yeah.
So they're doing transverse abdominis activations about 10 minutes a day for about 6 weeks during this. That was the exercise intervention. Mm-hmm. And they're also doing some group classes that were also focused on transverse abdominis. But the most important thing was their daily activation of the transverse. Mm-hmm. In the non-exercising group, they were just kind of carrying on their lives. So they weren't doing this deep TA activation. At the end of the study, 90% of the women who were doing the exercises did not have diastasis recti. And the women who had not done, sorry, I'm just like, I'm trying to remember all the details and I'm going.
That's okay.
Anyway, the non-exercising group had DR. And it's normal, it's to be expected. And right. 90% of them had DR. And the women who were doing the exercise did not have DR, except a very tiny percent. It was far milder than the ones who were in the non-exercising group.
And for folks who the transverse abdominis, it's the we're talking about the rectus abdominis is the part that gets pushed apart like the linea alba. That's the deepest core muscle. Its whole job is to stabilize things. So it's like not surprising that if you like strengthen and activate the deepest, most strategic core muscle, that it's gonna like outwardly affect the rest of the cylinder.
Yes.
Which is cool.
Yeah. And I mean, often people are like, well, how can activating a muscle affect the connective tissue? And the truth is our body adapts, including like if a sprinter is sprinting and they, they're going to get really strong calves. If their Achilles tendon does not also get stronger in response to training, they'll tear it, period. So we don't think, oh, I'm going to go to the gym and get stronger and really build my connective tissue. But when we build the muscles that insert into that connective tissue, everything gets stronger together because that's how the body works.
It's a system. It's like we say it all the time now. It's like, I love hearing that though. I love that example as well in the court. So 10 minutes of TA. Love that. That's easy enough. Well, not easy enough. Well, the challenge is to get someone to do something for 10 minutes a day, which is crazy. That's a whole nother conversation, the psychology of exercise. Like I can increase your chances of not pulling your abs apart if you do this for 10 minutes a day. So that's a side note.
But by the way, I just want to mention that. So the study showed that it's preventative. But in my actual experience with clients, I've seen women who've had second or third pregnancies completely resolve DR during pregnancy from previous pregnancies. That's how powerful it is. And it's the same exercises that we use to prevent as we use to rehabilitate and to heal. So, that of course, you have clients who do everything you say and they do it like 110%. And you have clients who kind of only move when they show up, to work with you. So there's, people vary, but my clients who've been the most disciplined and motivated, who really follow through, will actually heal either fully or partially during the pregnancy. And when I first started training women like 2008 using these deep core techniques, I thought our expectation was maintain. So if I meet someone, I take them on as a client and they already have DR, I'm like, well, we're going to try to keep it right where it is. It's not going to get any worse. And then after the baby comes, we'll help you heal. But some of those early clients were those overachievers who would do everything I said. And then when I rechecked them after 2 months, hoping that there was no worsening, they'd actually improved. So anyway, so that's just to say how powerful exercise is to do harm and to do healing.
What I think is cool, not like, I hate to like focus on like aesthetics, but that everything about the functional side of, I think we can all agree, like having your organs not spill out is amazing. And your body working as a system is amazing. And whether you're like pregnant or not, if you're like working with someone like me or you or listening to this video, like you've at least heard of the transverse abdominis, you've had a physical therapist for some reason tell you that you need to like strengthen your, so like, I love that. But also one of the things that stood out for me, and I'll tell the truth, like when a client sent me, I don't remember when there was a radio story that came to one of your workshops, I believe here in San Francisco. Yeah, and there was several women and one of the reporter, the person who was doing the reporting. And I'll tell the truth, like when, you're a trainer, client sends you stuff and you're like, okay, what am I going to read now? And I'm like, this woman is like measuring people's stomachs. Like what? And then after, obviously we're talking, so I listened and I was really touched, like how people, particularly like the client I was talking about, like was doing everything right and like just didn't feel like she was like, I know something is off. And listening to the workshop that you did, like how and you can fill in the details, but in a couple of weeks of doing some of these like transverse abdominis, and maybe you can talk a little bit about like the types of techniques, or like maybe give us like an example of an exercise. But what I found was so cool was like every person in that group who did, the lift was pretty low. It was a couple minutes a day for a couple of weeks, had like centimeters like off their waist. Like and I'll let you, I'm rambling a little bit, so I'll let you fill in and sort of explain what I'm talking about.
Yeah. So in this particular, it was a 4-week pop-up class. So it's kind of like a fitness class that met for 4 weeks, but there was a beginning and an end, and I asked that they commit to the series. And so I offered, it was optional, of course, but just because people often, it's like they need to see the measurements to kind of believe, right? So I do baseline measurements with everybody who wants to. I both check for DR, which I'll show you in a minute how to do that. So I check and measure DR and I record it. So, you know, your name is Katie and here's your measurements. And if they want, they can also track circumference measurements. And that's just another way that we can see change in the body. And it's not like I'm trying, you know, it's just like, well, you reduced by 2 inches. That's metrics, right? So
I hear this from mothers. I tease, like, just the article is like how to get rid of your mom belly. And I was like, oh, this is just going to be another like waist cincher thing or whatever. So like, it's valid. Like people want to get back, you know, that they feel like is theirs. So like, I think that's awesome. So measurements I think are great for the right people. So
some people love data. So the people who love data want to know. And some people don't want numbers as part of their consciousness. Like then they obsess and they're like, please don't measure it. And then they don't measure, you know, so it's all up to the individual. But if they opt in, it's really powerfully motivating because every time I do a recheck, there's positive change. And it's kind of what you put in, as you know, like, so the people who are doing like on average, and this is it's like a 4-week group. They're all kind of at a similar stage, usually of postpartum. They're supportive of each other. I email them to support them. I'm like, okay, what's the funniest place you did your core compressions? You know, aim for, you know, every time you go to the bathroom, do some core compressions just because you have a moment to yourself, you know, when you have little kids. Anyway, give them little like strategies to get it in throughout the day, but I want them to aim for 10 minutes most days. And on average, based on our surveys and like compliance records from the studies, they tend to get that about 80% of the time. That's great. So what I can tell you with certainty is that if you're doing these therapeutic exercises, most of the time, 80% shooting for every day, for about 10 minutes a day, you can expect to fully close DR in less than 12 weeks. So it was 11.25 weeks on average in the first study that I did with 63 women in New York. That was the first study. And then the second study was through the app. So the first study, I was working with women in person or in small groups, like one-on-one or in small groups. So they had that advantage. But everything that I've learned from my clients, from how to cue things to how to refine like breath that's not quite helping support what we need in terms of pressure dynamics, to palpating, there's only one place on the body where you can actually feel and palpate an activation of the transverse abdominis. So I teach them how to do that when they're doing the exercises so that they know with biofeedback that they are actually activating the transverse and not the more superficial. And I don't mean that from a judgment standpoint. More superficial layers of muscle that can make it look like you're doing a transverse abdominis activation, but you're not. You're actually using your rectus or your obliques or both. So anyway, I forget what the question was. There was a question.
Well, let's do this. So is it possible to show like one example of the type of exercise you would do in a class? Just like so absolutely. People can like start to feel like, if you're at home and you're like, I have no idea what my transverse abdominis is, like,
okay.
Let's do that. And then we can do the self-evaluation too.
Yeah. So I'm going to teach you core compressions and I'm going to do it standing because it's the easiest. But any body position where you can have your spine in neutral is a fine. So you can do them seated, you can do them in tabletop on all fours, back line, all of those options are fine. I also like to do fetal position. Sometimes maybe I'll do that on the mat too. I just want to show you one more thing with this. So the transverse abdominis is hard to see because it's underneath the other layers of abdominal muscles, but there's one area where it wraps over the other layers of abdominal muscles, and that's right here. So the transverse abdominis is like a giant corset of muscle. It wraps all the way around your spine, inserts into your hips, into your ribs, etc. But in the front, it's underneath your six pack and your obliques. The only place it wraps exterior is just over the crest of your hip bone. Okay. So I want to show you how you can palpate that yourself. Sorry, getting the camera. So by the way, when I'm standing, I'm going to have my knees a little soft, so I'm not locking out my knees. So I'm going to take my fingertips, find the hip bones, and sliding my fingers maybe like a little less than an inch, like somewhere between 1 centimeter and 1 inch in front medially. So I'm going towards my midline from my hip bone. Now I'm going to Kegel. And if you don't know what a Kegel is, it's that muscle you use to try not to pee, or you try to stop peeing if somebody walked in on you in the bathroom or something.
Yeah.
A Kegel, you should feel a band of muscle fire.
Yeah.
Fingerprint. Yeah, you feel it? See,
I do.
have a pelvic floor. So
I'll resist snickering jokes because we're serious people, but yes, I can feel it.
yeah. Okay, so I didn't say, hey, engage your transverse, right?
Right.
I said, do a Kegel. And what you just experienced is the synergy, the natural co-contraction between the pelvic floor and the transverse abdominis. There's also one with the diaphragm and with the rectus abdominis. And it all, like you said, it's a system. It all works together. So when I'm having people do the exercise, I will have them place one hand, fingertips over the transverse, pressing down so they can know clearly that they are actually engaging the transverse. And the other hand, I have them place over the belly because the direction of movement is important. And when we're doing these, we're not bracing. Bracing can actually increase intra-abdominal pressure and contribute to separation. So when you have DR, we're not going to brace. Instead, we're going to exhale as we draw the transverse abdominal muscle and all the related muscles towards the spine. So I'm going to place one hand here, and with my other hand, I'm going to palpate the transverse, and I'm just going to turn to the side so you can see a little bit. So I'm going to start with diaphragmatic breaths. So this is a very well-known sort of thing in many different traditions. But you're going to take a nice, deep, full breath, and then as you exhale, I'm pulling my belly button towards the spine, but I'm also feeling that transverse fire. Okay.
That's wild. I've never done that before at that spot. That's very cool.
Yeah. And you get the most powerful activation of the transverse when you consciously incorporate a Kegel. So you're kind of, it's almost like you're lifting up and in as you exhale, like bottom to top. So I'm zipping up from the pelvic floor to the low abs, to the middle abs, to the upper abs on an exhale. So,
well, this brings up a really good point too. That was like perfectly helpful. Like I could feel that, and I have a couple. I have a yoga instructor client, and I always say like I've never understood, like in yoga, for instance, it's a very common. They say like draw your navel into your spine, just like you showed, and you mentioned the difference between bracing, where bracing we push it out, right? Like if you're doing like, a maximal deadlift or like a maximal back squat, we don't suck in so much as press out. And so I think that's a really important clarification and distinction, especially when working, like if you are prenatal or like me working with someone, if you know you have, how do I say this? Bracing is a sound strategy in the absence of DR when lifting heavy in the gym, but in the when you know you have a separation, we need to pause on bracing, like right, to do more the traditional, like the yoga cue of like draw your navel into your spine. And I mean, it makes sense, right? Because the problem is we're out this way and we don't want to create what you mentioned, inter-abdominal pressure outward to further pull it apart. We want to draw it back in.
Yeah. But as we draw it back in, we want to do it mostly. I mean, you can move your spine through its full range of motion, but you mostly want to keep your spine in neutral alignment. So we're really so we're not like collapsing or like forward flexion. It's more neutral spine, and you're drawing up and in pelvic floor in coordination with your transverse. And like just a little story illustrates sort of what can happen if you're not actually engaging the transverse. I had a client in New York who came to me kind of desperate. She's like, I worked with a PT for 3 months. And by the way, I love PTs, so I'm not trying to diss PTs. She's like, I've worked on this for 3 months trying to close DR and I made zero progress. So I've heard you can help me, because I was kind of known as the DR personal trainer in Manhattan. She's like, if you can't help me, I'm getting surgery. So I was like, okay, no pressure.
No pressure.
I was like, show me what you've been doing. And so she showed me, and as I'm observing her externally, it looked very similar to what I would have her do in terms of drawing in and exhaling. So I'm like, well, let's see. So then I started to try to figure out what's not happening. So then I went over and I palpated her transverse, like right over the hip bone. So I felt here, and as she was doing the exercises, it was silent. There was zero activation of the transverse. So if you're exhaling and drawing the belly in, you may not actually be engaging the transverse.
It might be like all just like diaphragm.
Because you can use, especially if you've over recruited your rectus abdominis in your life or your obliques, those muscles might be doing the work and your transverse is just sitting there underneath, quietly doing nothing. So that's why it's really important that you incorporate the pelvic floor and that you initiate from the pelvic floor, because another thing that's really common when DR is present is prolapse. So if we just squeeze up here and we're not activating down there, we can make prolapse worse. So it's very important, the direction of movement, that it's like from bottom to top, and we're drawing in as we exhale and lift. So pressure escapes through our breath. So pressure exits at the top, and we're engaging bottom to top like you squeeze toothpaste out of a tube. And that it is important that whether it's a very conscious Kegel or sort of a passive co-contraction of the pelvic floor, but there needs to be some sort of lifting of the pelvic floor in coordination. And if you're like, I can't tell if I'm engaging the pelvic floor, I don't know what's happening, you can always go back to your transverse and palpate there. And if you feel an activation, you know you're engaging the transverse. And if you don't, then you should probably add a Kegel, like a conscious Kegel.
And if you are a woman who has, like, we have it, and we'll show, I know there's a test that we can do, which we can show in a minute. But if, I'm a trainer, and let's say, if I have a mom, obviously, like there's protocols for strength training, and particularly moms who want to like lift heavy and are used to it and conditioned to it. No DR, brace, fine, build back up, obviously. But if you you have the separation, we want to like, can they still like squat? Can they still do a plank?
Yes.
But we want to make sure when we do it that we're like not creating. Maybe talk a little bit about that, like help marry what people need to do, because I don't want someone to think, oh shit, like I can't lift weights anymore, right? And they're like, oh.
Yeah, no. And I mean, I come to this as a trainer. I love movement. I love strength training. I love getting stronger. I love the DOMs, like the delayed muscle onset sort of, or delayed onset muscle sort of. I love all those things. And you absolutely can train, lift heavy, but you're not going to probably lift your heaviest while you're still rehabbing DR. Like you're not going to go out and like play a basketball game when you've just sprained your ankle. Right? You can eventually play a basketball game, but maybe not like while you're still really working to like stabilize the ankle. So it's not like, oh, forever and ever you can't lift. But you want to lift in more of a moderate range where, yes, you're feeling fatigue after like 8 reps, 10 reps, but not like you're doing your 1 rep max. And with that sort of strength training, you can absolutely keep your core safe by essentially doing that core compression, that like drawing in as you exhale and kind of lift through the knee core. That you can do with a squat, so I'm going to inhale as I lower, lengthen, exhale with strength to rise. So the breathing that I recommend is that you exhale on the hardest work. Yes. So if I'm doing a squat, I'm going to resist gravity is harder than to go with gravity. So as I go with gravity, I'm taking my breath and I exhale, drawing strength to that deep core as I stand. It's also the same in like martial arts. Like when you strike, you exhale. And that recruits your deep core to give you a lot more strength in that punch than if you were just not breathing or doing some random breath,
But
so
if you have some weird, not weird, but like I think of like power lifters, and I don't train any moms who like used to be power lifters, but like, if they used to have a huge focus on the outward pressure, we can still lift weights with more of a drawing in the way that you've described.
Yes. Yeah. And I mean, it's probably a different conversation, but we can talk to you about some of the other, there tends to be some collateral damage with bracing and Valsalva maneuver. where it can cause leaking. It can lead to things when your pressure is going downward or outward. But that's a whole nother conversation. But if you do have DR, please do not brace and do not hold your breath while you're doing any work, because that
makes sense.
Will be counterproductive.
That makes sense. And I think we married it well. And again, I don't know if I'm sorry to and I'm picking on powerlifting just because I know they you wear the belt and you press out against it. But for general fitness and getting stronger, we can still continue once you are stable and we've bring you back together. That's not the right way, but you know what I'm saying. You can, using this technique, using the transverse abdominis, you can safely brace your core in a way that supports your abdominal structure.
Yes.
Yes. Okay.
Yeah. I just want to say one thing about planks, because you mentioned planks specifically. So planks can be fabulous, and they also can be injurious. It depends on how you do it. So you also might start strong in a plank, but as you start to fatigue, if you're not listening to your body and maybe lowering to your knees or coming out, go back in, if you kind of just push through and ignore some signs that your body can't quite handle it, then a plank could injure you, especially if you have DR. So typically, if I'm working with a client
I think gravity as well. Like you mentioned, our hernia, all your guts are put, in addition to maybe not being able to hold that inward spine, the neutral spine, but the inward and upward pressure.
Yeah.
If you're used to more outward pressure, and then you're like this, and all your guts are pushing on it,
Yeah. So, I mean, so it can actually help build strength. Then you're lifting against gravity if you're, say, on all fours, on hands and knees. So, which is actually a very safe and effective way to start to do core compressions, because gravity makes it really clear. When you relax the abs, they fall. And when you engage the abs, you lift them up, and it's harder. But it's a little bit easier to tell what you're doing. So gravity itself, if you're not in a full plank or a push up or something where it's putting so much strain right on the linea alba and how we use the muscles, I'm not worried about it. You could wear something. Also, people ask questions all the time about whether or not wearing a support is helpful. And especially early postpartum, or if the separation is pretty severe, a lot of women just feel better. They feel held in. It helps them have better posture, and it does accelerate healing. But just wearing a support garment by itself will not heal your abs. But it can, if your abs are, let's just say your abs are hanging out here because this connective tissue is weak and overstretched. When we put on, say, a corset or something, like one that's sort of a functional garment versus just for, appearance, it will kind of help approximate the muscles, meaning draw them towards the midline. So then they're held a little bit here, and there's less strain on the connective tissue. So it makes it easier to engage the muscles and to draw them towards the spine. It's also really helpful if you're wearing a baby, baby wearing, literally. A lot of the carriers have the baby vertically right on your midline, which is where we have the most vulnerable sort of tissue. So I say to moms, if they're wearing the baby a lot during the day, then it can help mitigate that pressure just externally of the baby's weight lying on your midline if you wear a little support underneath. So something more than a Spanx, but it doesn't have to be. In fact, I'll just show you, because you mentioned my app, Every Mother, which, by the way, we were just acquired. So that's a story. But
it's still, is that what it's called today?
It's still Every Mother for the moment.
Okay.
But I don't know how long that will remain.
Okay, gotcha.
So, but anyway, we developed these based on, for years, I would recommend certain different fajas or support garments for women, whether they had long waists or short waists or whatever, by different brands. But I was always like, oh, I wish it had this, or I wish it had that. So then finally we designed one with a lingerie designer here in San Francisco. They're made in LA, but they're really high quality and beautiful, really nice.
Yeah. The other thing looked like, I'm going to maybe say the wrong thing, but the other thing looked like granny panties. That looks pretty.
So this has 6 different eye hooks. So as you know, because we talked just about just the structure as your muscles come back together, then you want to like tighten it up a little bit more. So you can kind of wear this and adjust it. And it just gives you support to help promote healing. You won't want to wear something like this if you have currently prolapse, because it could, if you feel downward pressure, can be less helpful. But if it's mostly just like the front body separation, this can give you a little boost to your healing.
For a period of time, as long as you're doing the actual work,
yes.
I think that's what you said. Like, it's a fine support if you need that support.
Yeah.
In correlation with doing your training, your actual like exercises.
Yes.
Got it.
100%.
So if folks are wanting to know, like, if they have it or not, like, oh my God, I want to know. Can you show, I know that there's a way that you can self-assess.
Yeah. I'll show you on this mat.
And to give like a little context, like, I'm surprised, like, I guess moms now aren't surprised. I've asked a lot of clients since you and I started talking, like, hey, did a doctor check you before they sent you home with the baby to make sure like you're good? And one mom literally said, they just wanted to make sure that me and the baby weren't dead. And then they sent us home. And I've asked, and not a single, no, I mean, I like, you love PT. I love PTs. We all love doctors. Like, but it is, I've asked several mothers who had babies in the last 2 years, and none can verbally say, I was checked. Most said no, and most said, I don't think so.
I wasn't with either of my babies at the hospital, for sure not. But it's sort of like hierarchy of needs. Like their first desire is that baby lives and mama lives, and there's no like hemorrhaging. There's no like you're safe to go home. And then there's also, they now provide lactation consultants. They want to make sure baby can eat. But whether or not there's a musculoskeletal injury to your core is pretty low on their list in terms of their priorities. Which I get, like they're trying to like make sure we save everyone's lives, and there's so like definitely going home from the hospital, it's really rare for someone to get checked. Maybe if you have a midwife, they might be more proactive about that. But it's not standard. And even like at your first 6-week checkup, usually doctors don't even offer it, but if you ask, they'll check. So it's kind of like if you they might check you, but usually they're wrong.
It makes sense, but I guess because I've been a trainer for like 14 years, and like the amount of time, like every human I've ever worked with has said, oh yeah, and I know I need to strengthen my core. My core is important. Like it's become such an important thing.
Yeah.
In fitness world that it still is like, what? Like they didn't even like do this like little. So anyway, that's fascinating, and I totally understand the hierarchy of needs. But it still just blows my mind. So since they're not going to check you, you can show how we can do it check ourselves.
Yeah, absolutely. So, and I'm just going to mention, so I'm going to lie down in sort of a classic position. That's the position you want to put in to check yourself. But I also always remind my clients, especially if you do have DR or you suspect you have DR, you don't want to roll straight back or sit straight up, because that movement, like jackknifing up or rolling straight back, will kind of bulge your center line forward, which is the same, that mimics like a small version of the mechanical stress of pregnancy, which is what caused the separation in the first place. So you don't want to bulge your abs forward. And that actually applies not just to functional movement, but to your workouts. So if you're doing something in your workout and your abs are bulging forcefully forward, whether it's a brace or like a coning or doming, or just like your abs are bulging as you like crunch and lift your shoulder blades off the floor, any of those things are going to be damaging to the connective tissue. So I try to make it fun. And I'm like, when you're lying down in bed or getting up in the morning, do it sexy. Okay. Side plane is always safer and it's always sexier. So, I mean, just don't hurt your head as you, toss your hair, but lock it on the side, go down on the side plane. And then once you're there, you're going to take one hand and put your fingers vertically along your midline. So like I'm at my belly button, but I'm pointing down towards the pubic bone. If a practitioner is checking you, a PT or doctor or somebody, they will point their fingertips probably towards your chin. But unless you have extreme flexibility, like most of us can't do that. But the most important thing is that it's vertically aligned, because we're going to use the fingers to estimate the width. Okay. So like if I press my fingers down here and I lift my head,
I don't have DR, so there's nothing to see here. But let's just pretend I had a 3 centimeter DR. As I press my fingers down, the muscles will kind of grab when I lift my head. My rectus abdominis goes from passive to active. And that moment that it goes to active, I can feel a difference between the sort of firm muscle tissue and the more soft connective tissue between. And I'm trying to get a measure of the width and depth of the gully between the two halves of muscle. So if everything's passive, I can't tell the difference between muscle and connective tissue. So you have to lift your head just enough that the muscles activate, and then you can feel the difference.
Keeping your shoulders on the ground, not like a crunch, but just the head.
So you're just like nodding yes. And then you want to do the same thing. So that's right at the umbilicus, right at the belly button. You do the same thing above the belly button, like about 2.5 inches.
Mm-hmm.
And you're feeling for the same thing. You might have a different width. You might have a shallower depth. You might have a deeper depth. And so finger widths are approximately 1 centimeter. So if you're checking yourself, your fingers will be the same width, 3 months from now. So I might say, it's 3 fingers wide or 3 centimeters wide. And they went down to the nail bed or to the first knuckle or between the first and second knuckle. But you can give a landmark on your fingers so that you can also track the improvements in depth. Because as that connective tissue heals, you will notice the muscles come closer together, but also how deep you can sink your fingers will become shallower and shallower because that integrity improves. So anyway, so I do this right at the belly button. Then I do it about 2.5 inches above. Same thing, lift and lower the head a few times until I feel the muscles grab my fingers. It might be 2, might be 1, it might be 4. I've checked people with 10 fingers spread apart. Their abs are basically here, and I can feel their intestines pulse. Like that's
oh my gosh.
Severe. That's severe. That's probably surgery will be required. Exercise still supports like pre and post-op, but that person probably needs surgery. But anything like even 7 centimeters or less, typically you can resolve with exercise. Anyway, so then I'm going to bring my fingers down to the lower belly. So I'm now below the belly button. And then I lift and lower a few times here. And I record that width and depth. So the most common error that I see in people, whether they're measuring themselves or somebody else is measuring them, is that they lift their head too high. And the higher you lift your head, so like you go up all the way into a crunch, what happens is your abs kind of barrel forward from the biomechanics of that movement. So your abs kind of bulge forward and also towards each other. So you'll think that it's far narrower than it is. So you really want
like what you said. You said like nodding yes. That answered that.
Yeah. And sometimes I'll have people lift their head a little higher if I can't quite feel the muscles. And then they lift higher and they're like, oh yeah, that's definitely the muscles. And then I'll have them just barely lift the head. So I get a clear, accurate width measurement. And like if there's more adipose tissue in the area, it can be a little bit harder to feel. The easiest to feel is when there's a severe separation, but also strong rectus abdominis, because then it's a really clear contrast between the firm muscle tissue and the very stretched out connective tissue. I also check women during pregnancy. And so we can track progress, or progress in healing or wanting to make sure it's maintained. Sometimes there's a little head or a butt in the way of one of the sites, and then we'll recheck that the next time. But yeah, so like you can check at all times. Yeah.
That is fascinating. It's fascinating how big of an issue it is, how many people it affects, and how relatively simple the fix improvement can be, both structurally and aesthetically, because we all, people want to look, we want to feel the way we want to feel and we want to look the way we want to look. And it's nice to know that there is a system that supports that for whichever or both goals, right? So that we can move and feel and look great. I will, in the little description, I'll make sure to link to your website. So I know you work with clients here in San Francisco. We both are in San Francisco, but thanks to this world now, on the computer, you do work with people virtually. If someone had a question and they're like, hey, I don't know what to do, or I want to learn more, I know that you can work with people virtually, yes?
Yes. Yeah.
beautiful.
So they can reach out to me. My email is leah@leahkeller.com. My website is leahkeller.com. That also includes contact info. And yeah, I'm happy to answer questions. I do provide one-on-one training virtually, or 2-on-1 if you have a friend and you're like, hey, let's do this together. You know, the more the merrier.
Oh, cool.
Yeah. And I work live in person. I also have a lot of classes locally because I've just started really just enjoying being in real life with people. Because with the app development and managing all of that, it was a lot more virtual, and it's just so nice to be in real life with people.
Well, I'll keep my eyes on that. I will say I had, as I mentioned, I had a client who had her second, and interestingly, she had her second like way quick after the first. It was like a surprise. I thought she was kidding. Like we were like
pregnant, right?
We were just getting back to like heavy, you know, like all, you know, I have to say, my clients who are like training into like deep third trimester, it's just so impressive to me. Like it just, you know, and you know, it helps, right?
Yeah.
But yeah, she had her second like really quickly, and I was like, "You're joking." I thought she was joking, and she's like, "I am not joking." And I do recall that's when she was saying like, "Oh, hey, I'm doing these breathing exercises. I'm doing them at night. Like, don't worry. You know, it's just for, you know." So, you know, you don't have to worry about it, JJ. Just wanted you to know I'm doing it. And so I will give a plug. And now I've had 3 clients who are using your app. So, you know, I'm learning about this as well. I'm certainly not, this is a bit outside of my expertise. So I'm very pleased that the community has someone who spent so much time and energy to like learn, do studies, and to promote this information. So thank you so much just for doing what you do. It's definitely helped multiple women that I've worked with. And that's just even before I got to meet you. So I look forward to learning more. Can you send me, or can I find the studies that you did? Is that something I can include? That would be like super. I'd love to see that.
Yeah.
And I'll include that in the little description as well.
Awesome.
Well, thank you so much. I really appreciate you taking the time, and have a great 4th of July holiday.
Thank you. You too, JJ.